Si la voz en inglés le molesta, puede activar Mute Original Audio también en ese mismo botón. Si está asistiendo a través de su teléfono, busque los 3 puntitos de más, púlselos y seleccione Language Interpretation y después Spanish. Cualquier cosa, estamos para servirle en el chat. Bienvenidos.
Thank you, Eva, and welcome attendees to the community session on COVID safety. We are giving instructions for interpretation tonight, and then we will get started. Miriam, could you give instructions in Arabic, please?
السلام عليكم ورحمة الله وبركاته. مساء الخير، أهلا في اجتماعنا اليوم، اجتماع الذي سوف يتحدث عن مساء الخير جميعا للاستماع إلى الترجمة باللغة العربية. الرجاء اتباع التعليمات والإرشادات. في أسفل الشاشة هناك خاصية على شكل الكرة الأرضية، اضغط عليها ثم كلمة interpretation، بعد ذلك اختار اللغة العربية. إذا لا ترى هذه الخاصية أسفل الشاشة وتستخدم جهازك النقال، في أسفل الشاشة عند كلمة more اضغط على interpretation، بعد ذلك اللغة العربية. الرجاء كتم الصوت الأصلي حتى تستمع إلينا بطريقة واضحة، وشكرا. Thank you.
Thank you. And again, welcome to those who are attending the COVID safety meeting tonight. We are finishing interpretation and instructions, and then we will get started. Alex, can you give instructions in Mandarin, please?
如果你需要国语，就是普通话的翻译。翻译功能开启之后，你等一下可以到屏幕的下右方点击上面的地球标志，然后你可以选择普通话 Mandarin。这样的话，你会收听普通话的同传。也有选项可以关掉背景的原有英文声音。Okay, thanks.
All right. Again, welcome to, next slide, please. Let's see here. Welcome to our community meeting on COVID safety.
Jody, do we need Cantonese?
Yes, we had David give interpretation.
Let me do it, please.
Okay. Go ahead.
各位社區人士好，呢一度係新冠疫情安全社區會議。假如你需要廣東話翻譯，請你去熒屏嘅右下方點擊一個地球形狀嘅符號，然後選擇中文，咁你就會聽到我哋嘅廣東話翻譯。假如你需要廣東話翻譯，請你喺熒屏上面舉手俾我哋知道。多謝。Okay, I'm good, Jody.
Okay, thank you. So again, welcome to the community COVID safety meeting tonight. My name is Jody Talkington. I'll be helping with facilitation and monitoring the questions. You can see the agenda here tonight. There'll be a brief presentation by Janine Lindsay, our Ousd Director, Labor Relations, on our practices currently, and then a panel with Dr. Nicholas Moss from the county and Chaz Garcia, Second Vice President of OEA. And then there'll be the majority of the time open for Q&A. So let me pass it to the hosts of our meeting, Vice President Sam Davis and our student directors, Samantha Paul and Natalie Gallegos.
Thank you so much, Jody, and welcome everybody. Thank you so much for joining us. I'll be very brief. My name is Sam Davis. I'm the school board director for District 1 and Vice President of the board. And I just know how amazing it's been to see students back on campus playing, learning, building relationships together in ways that were not possible last year for obvious reasons. And it's wonderful to have them back. However, we're all understandably very nervous about the Delta surge. And so we want to keep our students safe. So it's really a great spirit of collaboration that we have Oakland School District staff, the county, and our labor partner, Oakland Education Association, OEA, as well as I'm really grateful to our two student school board directors who are joining us tonight, who've very kindly agreed to co-host and partner with us. And so without any further ado, I'd like to introduce them, Director Samantha Powell and Director Natalie Gallegos.
Good evening, everyone. My name is Natalie Gallegos. I am a junior at Oakland High School, and I am one of the student directors for this 2021-2022 school year. I'm so excited to be with you all tonight, and I hope questions are able to be answered so we can be more informed about the COVID safety in our schools.
everyone. My name is Sam Powell. I'm a senior at Oakland High School also, and I am the other student director in my second term for this new school year. Thank you all for having us in this space today. And as Natalie had said, we as a community are here to communicate our worries and strengthen this partnership with students. And I'm so excited to see how we can safely keep our students and teachers in school. And so thank you, Jody, again for reviewing our agenda today. We will be hearing from folks around COVID safety protocols, and we have prepared questions for our panelists today. And we'll be holding general Q&A, which will be moderated by our staff. And so we would like to start we will start with a brief overview of Oakland Unified's COVID safety protocols presented by Janine Lindsay, the district's Director of Labor Relations.
Thank you, Student Director. And we actually will spend very limited time going through our COVID safety protocols. All of this information is available on our website. So we don't want to spend too much time going into detail, but we would like to just give a brief overview and then answer questions at the end. Next slide. So just to point out that vaccine outreach is key to keeping our schools open and safely open. And so we're excited about the partnership with Alameda County and lead community agencies to host 7 vaccine pop-ups for students, staff, and faculty. You can visit ousd.org vaccine for registration. Just click on the link. Next slide. And COVID testing, of course, is a hot topic in OUSD and most school districts. And the availability of those tests is an even hotter topic. And so, but we have a testing program that is 10 regional test locations, a rapid response team that's deployed to schools to support modified quarantine or outbreaks, and at-home rapid testing kits. And we strive to have those at every school site. As a point of comparison, OUSD has testing locations, 10 regional testing locations, and it's 21 times greater access to testing in OUSD based on size. Next slide. So you can visit our ousd.org to make appointments to schedule your testing. You can also reach out to your principal and school location about rapid at-home tests. The hours and days are subject to change, and we are working to figure out ways to have more accessible hours. We know that 9 a.m. to 4 p.m. is often the time when families and staff are working. So stay tuned and we'll have more information on our website. Next slide. So as explained in one of our previous slides, we do have a slightly lower positivity rate, at least as of August 19th. Alameda County is 4.5%, 4.56% at positivity rate, and OUSD is slightly lower at 2.15%. So we'd like to keep this testing going to make sure that families, students, and staff have access to those numbers. And if you're interested in seeing more about the positivity rate or positive cases, please check out our dashboard. It's updated every day at 7 a.m., but the most accurate information is available on Mondays. Next slide. Contact tracing is probably the hugest lift in OUSD in terms of responding and keeping our schools safe. And it includes a COVID testing team, a COVID team that meets with our principals. But what you should know, if you have a positive case, you should immediately notify your principal or supervisor if you're staff, and the principal will actually activate our contact tracing team. I'd like to give a shout out to our contact tracing team that is working day and night and weekends to make sure that folks are contacted and that the contact tracing protocol is followed. And quarantine guidance will differ based on vaccination status and as to student masking compliance. So please, if you have a positive case instance Or if you'd like more information about contact tracing, please reach out to your principal or supervisor. Next slide. Lastly, our investments to improve student safety from COVID also includes ventilation updates. We have been installing permanent IQ air purification systems in many of our classrooms, particularly in East and West Oakland. All classrooms have been outfitted with 2 HEPA air purifiers on top of existing HVAC systems. We know that as air quality issues may surface, we will have to continue to look at how we're dealing with large spaces. Next slide. I believe that is the end. But lastly, we want to just share that it's understandable and natural that we are all anxious and concerned, especially given the Delta variant and others to follow. But here's what we can all do to keep our schools safe and make it easier for staff and students to focus on learning. First and foremost, get vaccinated if you can, and this will be required for staff or weekly testing as of September 7th. Wear a mask indoors and outdoors. Stay home when sick. I have to say that one again. Stay home if you're sick. Wash your hands or use sanitizer frequently. Get COVID tested if you have symptoms or have been exposed. And if you're unvaccinated, you should be getting tested on a weekly basis, and notify your school if you test positive. And I'll also go to the next slide to show how you can report any safety concerns. We're lucky to have Salja Sharesh on this call. You can contact her directly. Rebecca Littlejohn, who works in our risk management department, is also available. And for any staff, please reach out to the talent/HR department if you have any questions. Here's also a link where you can anonymously report any of your concerns. Next slide. And now we're ready for questions. Jody, I think I'll turn it back to you at this point.
Yes, and so most of you have been working already, but if you haven't noticed, the chat is turned off for this meeting. We are using the Q&A because it allows us to answer questions individually and track all the questions to make sure there is a response. The Q&A function is at the same place where you can find the chat under your screen with the letters Q and A. So please use that to ask your questions. Staff will be answering during the presentation, and we will have, after a panel that we're about to have with a doctor from the county, we will have an open Q&A session, but at the moment, type in your questions as they come. So I'll pass it back over to Vice President Davis to start the panel.
Thank you so much, Jody, and thank you so much, Ms. Lindsay, for the presentation. And I believe I will pass it over to Director Powell to introduce our guests.
Yes, thank you so much. So our first panelist that I would like to introduce is Dr. Nicholas Moss. Dr. Moss is an infectious disease specialist and epidemiologist. He serves as the county health officer for all of Alameda County, whose Department of Public Health supports districts across the county in implementing guidance from the state on their COVID safety plans. Dr. Moss, you just saw the presentation from Oakland Unified. How has the county been involved in helping OUSD to develop its COVID safety plan and procedures? And how are you tracking whether these procedures are enough to prevent infections as much as possible?
First of all, thank you for having me here on the panel. I'm really glad to be here speaking with the OUSD community about coming back to school. Distance learning has been very difficult for children's education and mental health. And actually today we joined 11 other Bay Area counties in the city of Berkeley to reaffirm our support for in-person education because of all the benefits. Certainly we're still in this summer COVID wave, but actually our rates are lower here in the Bay Area than in many places. And we are not seeing what we saw even during the winter surge here locally. We are certainly seeing cases in children, but actually at the levels you'd expect given what's going on around the region. and very few hospitalizations in children, unlike some of what you're hearing in the news. In terms of working with OUSD, I just want to note that OUSD staff have been a great partner throughout the pandemic. We have been working on schools issues really since the very beginning. So at the county, we provide technical assistance on COVID guidance. The guidance is actually currently set by the state, but we help OUSD and other districts implement that guidance. And we, when there are cases in schools, those have to be reported to the county. So we get that information as well, and we can help when there are, in certain situations, we can help with the investigations. Just want to reiterate how much hard work the OUSD staff have been doing. It's a big learning curve getting back to in-person education, and we have really seen a lot of work going into making it possible for kids to come back as safely as can be done. And so I'm really excited to be able to partner in that.
Thank you. And now for our next question, looking at the numbers of positive cases for the first 2 weeks, are we seeing outbreaks at school? Because we have been having large number of positive cases at our schools, and in several classes have been quarantined and are not getting the full education experience they should have been getting. Is there a number of cases where the entire school would have to be on quarantine? Overall, can you tell us what is going well and what needs to be done better in our OUSD response to COVID?
Well, yeah, so first of all, the way the guidance works, there's some things that have to happen, and you actually saw that stuff on slides. The universal masking, really important, making sure people are staying home when sick, washing their hands, all that kind of stuff. Every school has to do that. Every district has to work to get that done, and we're helping districts across the county with that. And then there are some things that can be done differently depending on the needs of the school community. And so we certainly are available to help schools figure out what they're going to do, what makes the most sense. And I think again, OUSD has really done a great job in putting together a safety plan for its community. There are certainly going to be cases of COVID identified in school communities, particularly when you're doing a lot of testing. You're going to find cases. That doesn't mean that those cases were that somebody got infected at a school setting. In fact, we know lots of COVID transmission happens at home or in social settings. Certainly some is going to happen in the classroom. And when there are cases, children who test positive in a classroom, if there are 3 or more, we help with an investigation to see what's going on. Sometimes there may be transmission in that classroom. Sometimes there may not. Sometimes it can be hard to know for sure. And we want to make sure that children who are close contacts either go home in quarantine or stay in school in what's called a modified quarantine. And what works best is going to be different for different schools, depending on what's going on and depending on their resources. One thing at the county is that we don't set a place where we say you have to close this classroom. We take that on a case-by-case basis. But at the school level, at the district level, based on what schools know is going on at ground level, they may decide to set a threshold. I think there was more to that question, so you're going to have to remind me what I left out.
I believe you got most of it. So just to clarify, so there isn't like an exact number of how many cases will have to be at a school site in order for a whole school to close down. That would have to all depend on the school district.
Well, from a public health standpoint, and again, this is really, our role is to work, help districts across the county figure out how to apply the state's guidance in the best way possible. And so from our perspective, we really want to keep kids in school as much as is safely possible. And that means really focusing our efforts on finding out who needs to go home, who can stay in school, and doing everything we can to keep kids in school as much as possible. So there may be a situation that comes up where we just don't know who is exposed, where it's hard to tell, where lots of classrooms are affected, but we don't set a rule where we say, if it gets to this point, we're gonna ask every student in school to quarantine, because we really don't want to disrupt education if we don't have to.
Dr. Moss, so I've heard you talked a little bit about modified quarantine, and it's a great transition into our next question. Why are students allowed to continue attending school in a modified quarantine even after they may have been exposed? Is the county rethinking that guidance based on what you have seen so far? And secondly, when a whole class is quarantined, why are vaccinated students allowed to keep coming to school while unvaccinated students have to stay home for 10 days? I also know from experience that, families are having some questions and the feelings of uncertainty when we're getting so many emails a day based on, close contact or date of exposure with cases that are positive.
Well, I'll speak to that first. So, there's definitely COVID around in our communities, and it's not just in schools. In fact, I think schools have been shown to be very safe when the safety measures are in place, even when COVID is circulating. A big part of that is having masks on everybody, and also having systems in place to keep people home who are sick. I can understand people being concerned, but actually that's the system working, parents being made aware, okay, there's a case, we identified it, we know that some kids may have been exposed, here's what we can do. I understand that's concerning for parents, but I actually think that is what we want to have happen. We want to know when there's a possible COVID exposure, and we want to act accordingly. Modified quarantine is a way to make it so that's not too disruptive to students' learning, right? We know we have these other safety measures in place. Students who have been exposed but aren't sick, aren't showing any symptoms, if everybody's in masks, under certain circumstances with some testing, those kids can stay in the classroom. But the flip side is it can be it can be a lot of work to do modified quarantine. It's a lot of testing. It's a lot of figuring out exactly what's going on. And it might not always be the easiest way to manage a situation. And so sometimes modified quarantine isn't going to be the best bet. And we've made it clear that schools and districts across the county, they don't have to use it. It's an option that's available. But if it's complicated because there's a lot of cases or something like that, it doesn't have to be used. So again, the overall goal, we really want to keep kids in the classroom to the greatest extent possible. But sometimes a practical approach, just making sure people who are exposed stay home for the time being is going to make sense. Oh, and one other thing I wanted to say, that actually modified quarantine, that is one that comes directly from the state guidance. That's not an Alameda County policy. And the state lays out different options for quarantine in school settings, again, with the goal to really avoid disruption if possible.
I also want to just ask, how do we know that our safety measures are enough? Because I know students who are staying safe and making sure that, they're practicing the COVID protocols, but still they're still exposed. We have positive cases in those students who are staying safe. So how can we ensure that, our safety measures are enough?
Well, one thing is, seeing what happens when there are cases in a classroom. So if we see some cases pop up, but most of the other students aren't affected. That's a good sign that things are working, right? And again, as I said before, sometimes there is going to be spread in classrooms. I think we just have to prepare for that to happen from time to time, especially when COVID is really circulating in our communities the way it is right now. Hopefully that's going to improve. So that's one of the most important things. And then at the county level, we can look and see what's going on really across all schools, and even learn what's going on across the state, and think about whether there are other measures that that need to be adopted to help keep kids safe. And this is right now, as so many schools are going back to in-person for the first time in really since early in the pandemic. A lot of that is happening. We're watching closely. We're going to see how things go, and if we have to adjust, we will. And one other thing I just wanted to comment on is that you asked why vaccinated people don't necessarily need to quarantine, and that's because we know that while vaccinated people might get infected, their risk of infection is a lot lower, and we're still learning how likely it is that they might infect somebody else. But remember, with masks on, you're really going to cut down that risk no matter what. Now, if you're vaccinated and you're sick, you still need to stay home.
Thank you. And with that being said, what is the county's advice to OUSD on COVID testing strategies? And is testing all students regularly an effective way to detect the outbreaks early and to prevent further infections?
So the most important thing is to make sure people who are sick, who have symptoms, that they get tested. And then we want to make sure that people who are exposed get tested. That helps us figure out early if COVID is spreading from person to person. So those are the things that we really stress. And now the state schools guidance includes several different options for testing, and they have strengths and weaknesses, and there's no one single strategy that is the right strategy for all schools in all situations. And so for that reason, schools can pick from those options and use the thing that's the testing strategy that's going to work best for their community.
Thank you so much, Dr. Moss. I appreciate you participating tonight. And thank you for staying on as well to answer questions from the public after we hear from our next panelist. Chaz Garcia is a bilingual fourth grade teacher, the second vice president of OEA, our teachers union, and has been serving as the lead negotiator for OEA in negotiations between the teachers union and the district. So welcome, Chaz, and thank you for joining us. My first question is, can you speak to how the union has been responding to teachers' concerns about COVID safety? And from your perspective, what's been working well in the collaboration between OUSD and OEA on COVID safety, and what needs to change?
Thank you, Director Davis, and thank you for the invitation. I also want to just quickly show appreciation to our student directors for the unwavering leadership that I see them kind of modeling for the rest of us. So, thank you all. Yes, so OEA has several structures that existed prior to the pandemic that have lent themselves to supporting teachers being able to address and resolve issues as it relates to protocols or concerns that come up as a result of COVID-19. So aside from those structures at the site, some of those are embedded in our contract, where we have a faculty council that is a place where the staff works with admin around resolution of issues. So that's one way. And I think that's been really important because we also have our safety leads who are involved in these conversations, and really a very collaborative spirit as we are all experiencing this pandemic together. And in order for us to get through this and for our students and our staff and community to be safe, we must continue to collaborate. So that really kind of lays the foundation. In addition, leadership, myself, I'm a fourth grade teacher, but I'm currently not in the classroom. So along with President Brown and Vice President Armendariz, and also our community schools director, Ms. Thais Rancifer, have been out doing site visits at sites that traditionally have more issues, just to do one-on-one have one-on-one conversations with members and be able to address anything that surfaces. We put into place a safety hotline so members know that if there's something that is very critically needing to be addressed, that they can reach somebody because it's monitored every single day. So those have been really important pieces and have helped us address things that have been surfaced. So to that point, there's been great collaboration from some folks who are behind the scenes on the district's behalf right now, like Salja Sharesh and Preston Thomas have both been super responsive when something gets escalated or elevated, like a ventilation issue. That's not something we want to go through the normal channels of the system, because that's could create a delay, in which case, perhaps students and staff don't have the proper ventilation, and we don't want to see that happen. So in those cases, I've been able to have conversations. Preston and I have done walkthroughs together and been able to resolve issues that actually there were some shortages, but it was because these things are all new for all of us. And really what it takes is the communication between all parties to make sure that if we don't have something, we say something, and that we are working to resolve those issues. And to that piece of being collaborative and really appreciating folks who are driving the work in central office, that has been a big piece. And we would like to see and call in the county as well. I know President Brown invited Dr. Moss to join us and have lunch in one of our cafeterias, because speaking of the Swiss cheese approach of protection, we know that one of the big pieces is ventilation and masking. And when we're eating, that creates additional risk. And so really looking for a collaborative way to address these issues and wanting to call in Dr. Moss so he can see firsthand. We are aware that our rates are lower than previously, but as always, Oakland leads in those rates, and some of our zip codes are rather high. And so we would like to see that additional layer of collaboration from the county to help us work with the district and really get at the best way to support the safety of the school community. I think
Thank you. So now for our first question, when a class goes out on quarantine, how are teachers supporting our students to not miss out on learning? Will there be a distant learning in that situation? And how are teachers supporting individual students who have isolated or quarantined at home so they can stay on track with school?
Thank you for that question. I want to give a shout out to our teachers who are like walking this walk right now. And I've talked to so many since school has started, because as you know, everybody on this call, we've had students have to quarantine. And so teachers have pivoted and really been able to use some of the innovative resources that were created last year while we were doing distance learning to support asynchronous learning. We currently don't have a district policy that enables each school site to have a distance program, which is why we saw the creation of an independent studies program separate from school sites. So we are currently at the table and delivered a proposal where we are looking at providing the space and time for teachers to create long-term plans, because we know that it is very probable quarantine is coming to everyone at some point or another, and really wanting to be able to provide our members with the time to have thoughtful asynchronous plans that will support students, and absent the ability to do distance learning from school sites. And aside from that, teachers are calling, checking in on students, making sure, because there are some students who aren't coming to school because their families are concerned about transmission, as they're seeing the rates or the positive cases pop up around the district. And so the whole school community, not just teachers, I'll say, has really, in places like, and give a shout out to Lockwood, they're doing an excellent job really connecting with community and checking in and being able to provide those resources.
So our very last two questions is how can the union partner with students to address their concerns around COVID safety and to educate the student community about vaccines? And the next question would be, how do we work with students to feel comfortable and safe in their own schools?
Thank you. Those are excellent questions. We do work with student groups. We're on, we sit on several different coalitions, and I think it's really important to call students in and have those collaborative discussions. J4OS has been a great kind of resource in that regard, and there's some other coalitions as well. And I think ultimately it involves, as always, we need to listen to the youth and hear the concerns so that we can collectively talk about how to address them. We've had some ideas, and we definitely, myself, absolutely, will be more than happy to, sit down with ACC or anybody else to do some brainstorming and really have a targeted campaign. I mean, aside from the fact that we have our members who have, daily contact and are building those relationships with students individually, I do think it's important that we collectively have these conversations in order to really kind of help everyone really be clear on not just vaccinations, but testing and why those two things are so important together, and how we can address some of the, positive rates and just screening for different schools to help protect community. And I think that, we're always stronger together. The more we collaborate, the better we'll fare in this pandemic.
Thank you so much, Ms. Garcia, and thank you, Director Powell and Director Gallegos. That concludes our panel, and now we can move on to general Q&A. And so I will hand it back over to Ms. Talkington to help facilitate the Q&A portion of the evening. So we have, I think, a good solid 35 minutes for Q&A, so that would be great.
Great, thank you, Vice President Davis. So I'm going to start, I do see some raised hands, but I'm going to start by pulling out some common questions in the Q&A first, and then I'll go to some live questions too. So I want to come back to modified quarantine. There are several questions. I know we spoke to it quite a bit. Thank you, Dr. Moss, for explaining. But if we could just take a bit more time there. There are some attendees that are asking, what is it exactly? So can you describe, like, what is the actual steps, where there's knowing where you have the option of staying home or testing? So explaining that a little bit. And then why I'm asking you that versus a district staff is if you can share the science behind that, of why that is being recommended as medically safe. And there's some more questions, but I'll start with that.
Sure. I mean, I think in terms of like what's medically safe. So this goes back to balancing the risk of being in schools with the benefits of being in schools. So it's not just about whether you can drive, the risk of COVID transmission to zero, but also whether it is more beneficial to have kids be able to be in class as much as possible safely versus spending a lot of time at home. And remember, there's always way more people who are, one case means a lot of people exposed and in quarantine, although it doesn't necessarily mean that all those people will get infected. And so you really want to do what you can to try to minimize those disruptions to education. But yeah, it's a balance. The way that you reduce the risk that somebody in modified quarantine, could become infectious in a class is through testing. So what modified quarantine means is if you had a mask on and the person that has COVID in the classroom had a mask on, even if you were a close contact, if you're not sick yourself, you can stay in class and get tested, but continue to have in-class education as long as those tests are negative. And this is something that has been tried in some places, and I think with some success. And so that's why the state of California included it as an option in its guidance. And again, really trying to balance accepting that having kids in class as much as possible comes with a little bit of risk, and we need to think about the cost to children in terms of being at home more, having their learning disrupted. So I think between masks in class and testing, modified quarantine does not present a huge amount of risk.
Great, thank you. And then some additional questions around modified quarantine. I think this is more of our implementation from OUSD. So these questions going perhaps to either General Counsel Daniels or Salja Suresh. Can you speak to the testing that's given when somebody needs to go into modified quarantine for close contact, and the turnaround time? There's some questions of how are we certain that the families are getting tested? Is that on an honor system, or is the site monitoring those students getting tested if they have decided not to stay home? And then with the time it takes to get the results, can you speak to how we're monitoring that and how that how that's safe, or why that's the plan that we have?
Sure, I can start, and then Mr. Daniels can add more information if needed. So in terms of the testing that's provided on site to students who are in modified quarantine, going by the guidance that is in CDPH, rapid testing is sufficient, but we try as much as possible to do both rapid and PCRs, both so that if there is a rapid result, we can immediately then take that student and then begin their isolation period if there is a positive case. And then, of course, to do the PCR so that we are using the most accurate test available, but of course have to wait a couple of days for those results to come back. And if there is a positive, then we would begin the contact tracing process for that student. And then in terms of, I think one of the questions that I saw in the Q&A was around, the rapid tests take like 15 minutes to get results. Why do I have to wait until the end of the school day to get my results? And that's really just a function of the kind of the shift that the tester has in their process of collecting tests. So it's true that it's very quick to get the swab and actually get the test, and then 15 minutes to get the result. That result is then logged in the primary system as part of that open session for testing that day. That session then gets closed and locked at the end of that testing period, which could be 5 or 6 hours later, depending on how many students were tested that day. And then once all of those results are locked, then the primary system releases those results to the families and to the test admins. So that's kind of an explanation of that delay there.
Okay, and can you speak to why it's after 3 cases instead of 2 cases when the modified quarantine starts, and then just how we're monitoring to make sure everybody who is on modified quarantine is getting the testing?
Sure. So just to clarify, we begin modified quarantine after 1 case. So if we find that there is 1 student who is actually COVID positive, who has been on campus during their infectious period, as defined by 2 days prior to the date of their first symptom or the date of their positive test, whichever came first. If the child was on campus in those 2 days prior, then we would begin a modified quarantine for that student's prolonged close contacts. And then there's another threshold of 3, and that's generally speaking looking at about 3 cases within the span of 2 weeks where students would have overlapped with each other in terms of their last date on campus and potential exposure to each other and their test dates, and would then move into an at-home quarantine for that group of prolonged close contacts.
Great, thank you. Okay, so some other questions about testing. Can you speak to, are we going to be increasing the hours that the testing is offered, like before or after school, or increasing the number of days at site? And so maybe potentially part of this, can you also speak to the the what we're doing to increase our rapid response teams and having more people on sites for those.
Yeah, so I think there's two things that are happening with that. One, right away, actually immediately, there are community testing locations that are available after hours until 5 or 6 o'clock at night in many places, and on the weekends, on Saturdays and Sundays, that are not run by OUSD, but that are open and that are free for families, staff members, students who want to go get tested. And we can put that information on our website. It is also on the Alameda County website of all of the testing locations that are in Oakland, Berkeley, Emeryville, in the whole county. And so that's something that's available right away. In terms of the expanding the hours on our sites, as well as expanding the size of the rapid response testing teams, that is very much limited by the number of staff that we have available. So we are working with a company that's been contracted by the state, and the state has very graciously said, we know that you need more testers. We will send you more testers. We are waiting for those testers. Once they arrive, we'll both be able to expand the hours at our hubs, as well as be able to expand the on-site testing across the city.
Great, thank you. So these next questions are about mandated vaccines. So I think I'll pass to Vice President Davis. If you could speak to what we have in place right now for mandating vaccines for staff, and then also what we're thinking about for what we have in place, or what we're thinking about for mandating vaccines for students. And or there was a question. Well, so I'll start with that. I'll say, Chaz, there is also a question about how OUSD and OEA will be working to educate students and their guardians about vaccines. So even student board directors, if you want to answer that too. But let's first go to Vice President Davis about what we have in place about mandated vaccines, and then we'll go to our union rep and our students to speak to the education plans for students. Are we having trouble hearing Vice President Davis? Yeah. Can't hear you. Okay. Well, as he works with that,
would you like me to go over it? This is Tara.
Yes, please. We have our Chief of Talent, Tara Gard, can answer that question. Thanks.
Director Davis, I'll take it just because your volume. So for staff, we are requiring for all employees to either be vaccinated or test weekly. And we are, our deadline actually for employees to provide us with their vaccination cards is this Friday. And we're collecting that information, and then we're reaching out to our employees who are unvaccinated so that they know what that process is for weekly testing.
And actually, Ms. Gard, if I could ask, there was also a question about if we're publishing if you have offhand how many of the percentage of staff that are vaccinated, or if any of that is public, and if not, what requirements are there, but just what families can know about the percentage of staff being vaccinated.
Sure. Well, I can say, so prior to the mandate, we asked our staff to self-certify their status. So with the self-certification, it was about 90%. However, now we've asked for proof of vaccination, and I won't be able to give you that number until we've gone through all that. The deadline for that is tomorrow.
Okay, thank you. And then the second part of that, Ms. Garcia and student board directors sharing if any plans that you're working on to educate students about vaccines and their guardians.
Yes, we've actually, OEA leadership has been in conversation with the superintendent and some of folks from her cabinet around not just a campaign to do education around vaccines, but also testing, because as we heard earlier, those are both important pieces. And so there has yet to be a conversation where the students were actually in that conversation. And I think it is critical because, as I said earlier, they're modeling what leadership is and absolutely can bring ideas and and innovative ways to do outreach to some of our communities who are not getting vaccinated or even agreeing to be tested. So we've had conversations about both of them and would love to have conversations with students directly as well.
Great.
Can you hear me now?
Yes, we can hear you.
Hey, good. So also as a board member, I mean, I've been having conversations, just about, and I know there's been some discussion about mandating vaccines for students age 12 and up, but what I've been hearing just from folks on the ground who are doing the vaccine clinics is there is so much vaccine hesitancy. So we know that only 54% of teenagers aged 12 to 17, in Oakland are vaccinated. And there's a lot of myths out there. There's a lot of misconceptions and hostility towards the vaccine. And so that's where I really welcome the partnership of OEA and the All City Council, the student board members, in trying to counter that and really let people know the vaccine is safe and effective. And so some of the things we've been talking about as a first step is just, and this is still in the preliminary stages, we're just discussing it, but it's just
I think we might be losing you again right at the part of what we're discussing. We'll come back to you, Director Davis. How about Director Powell, Student Director Powell and Student Director Gallegos? Do you want to share anything that you are talking about as students in terms of education about the vaccine, or anything you have in plan?
Yes, so we're working with some central staff to get medical professionals at our first high school meeting to share information about vaccines. And that's where we'd like to consult, with our delegates in that space, and going to have like a communications and conversations at the high school meeting so that students can share their hesitations. And so just being able to right now do outreach and engaging our students, our high school students, and them sharing, their different concerns in the space that we will be having.
Okay, thank you. And Director Gallegos, do you want to say anything? Did she cover
I think Sam covered it all pretty well.
Okay, great. And Vice President Davis, you want to try again? You were just telling us you were about to start having conversations around something.
Yes, if I can get Zoom to work. So yeah, I mean, I think some conversations were requiring vaccination in order to participate in sports, offering incentives to students who get the vaccine. It could be a number of things, but I think we need to take it in a sensitive way, recognizing that a lot of students aren't there yet, and so we really need to get the information out there. It's as much an education campaign as it is putting out the requirement, which I think we will get to at some point.
Okay, and then lastly, this might be again to General Counsel Daniels or Ms. Suresh. There's a question about just how our protocols for students who are able to get vaccinated change if the student is vaccinated or unvaccinated. Can you speak to a little bit about how the difference is then, because some students are able to get vaccinated?
Yes, so for students who are vaccinated, and this is true of staff as well, if you were identified as being in prolonged close contact as someone who is fully vaccinated and asymptomatic, you do not need to quarantine. And that is both Cal OSHA guidance for employees that you should come to work, even if you are identified as having been in prolonged close contact, as long as you are fully vaccinated and you are not showing any symptoms. And if you are unvaccinated, then you should begin quarantining, right? And that quarantine guidance differs based on whether you were masked, whether you were unmasked, whether you are staff, or whether you are a student. But there is definitely a distinction between how fully vaccinated and unvaccinated individuals are treated in the state guidance.
Great, thank you. So I want to speak to just a couple questions about masks, and then I'll go into some questions I see about testing. So with masks, can we explain our protocols, especially for, we know we have a protocol if our masks are required indoor and outdoor on our campuses by staff and students, except for eating lunch. So can you speak to a little bit about what the protocol and what sites are doing to support the times when students take their mask off to eat lunch? If there's any social distancing there, if so, why or why not? If they're eating outside, what our requirements are and what sites are doing to support the safety around lunchtime.
So there's a few pieces of guidance and a few safety measures that we've put in place around lunchtime. So one, certainly encouraging eating outdoors as much as possible. Two, knowing that's not always possible, either because of inclement weather or because of smoky conditions, trying to make the indoor space as safe as possible. So we've improved ventilation in all of our cafeteria spaces. So we've got MERV 16 filters and the HVAC system so that there's filtered air in there. And then we've also purchased large drum fans to actually improve the indoor-outdoor circulation. So they're sitting at the entrances and exits of the cafeteria to aid in the air exchange that's happening in those large spaces. And then also many schools have worked out staggered lunch schedules so that there's not the entire school or an entire grade in the cafeteria at any one time. And with fewer kids in the cafeteria, they can sit further apart. So you've got distancing added there, as well as reduced amount of time. So really making sure that students are eating in a shortened amount of time, ideally less than 15 minutes. Again, keeping in mind that important metric of what it means to be in prolonged close contact, which means closer than 6 feet for longer than 15 minutes. So making sure that we're doing everything we can to keep those indoor air spaces safe, and then also trying to reduce the likelihood of there being prolonged close contact.
Great, thank you. So now I'm going to move to some questions about testing. So first, can you just give a description of all the different types of tests that we have, and when those tests are used, the different purposes are used, and what the test type of information they can give us?
Sure. So right now we have 3 different kinds of tests that we use. And I'll explain them a little bit and the different ways we use them. So we have 2 kinds of rapid tests, one that are intended to be used at home. And those are largely for peace of mind if you're concerned about maybe an exposure that happened outside of school, if you're not feeling well and you just really want to be able to get an early diagnosis of whether or not you might be COVID positive. We have the at-home kits. We have also rapid antigen kits or rapid antigen tests that are provided by our rapid response teams when there has been a case that was on campus, as well as at our hubs. And again, those rapid tests get read in about 15 minutes. And the intent there is to kind of do early detection of whether or not there is a positive. And then there's also the PCR tests. And so the PCR tests, of course, are the most accurate tests that we have available. We try to pair those with the rapids as much as possible so that you are getting that confirmation very quickly if there is a positive that can be detected. And then you're also getting that confirmatory PCR that comes a couple of days later that is much more sensitive and able to detect the virus in much smaller quantities. And again, both of those tests are available at all of our hubs for drop-ins and also at the rapid response teams for modified quarantine. I also want to point out, there have been a lot of questions and a lot of concerns around the testing program, and we definitely have heard that both last night and a lot of these sessions. We know that it's really challenging that you go to get tested at your school site because there's a modified quarantine, or you go to a hub site and maybe there's long lines and maybe they've run out of one of the kinds of tests. And I want to just acknowledge that those frustrations are really real. And we've been working with our testing partner, Vestra, as well as the state to say, please send us more tests, please send us more testers. This is in very high demand in our community. We want to make sure that we are trying to meet that demand to the greatest extent possible. One of our testing coordinators who is on the ground drives to Dublin every day to get a whole shipment of tests so that we don't run out and so that she can take those to the schools that are getting modified quarantine testing on that day. So in addition to kind of waiting for the state to deliver us. We're trying to be as proactive as possible to get the supplies that we need and get them to our schools.
Great, thank you. And then to Vice President Davis, can you speak to what the board passed last night about expanding testing and what that will mean? We have all of those tests and what will change given the vote last night?
Sure, I can try to address that. So what we passed last night is a resolution continuing to expand the rapid response teams, directing staff to expand the hours at the community testing sites, the regional testing sites, the 10 sites that, you know, as was pointed out earlier, they're only 8 to 4, and that's not always the best time for students and staff. And so we want to expand those hours, and as testing capacity increases in the district, we will begin regular testing of all students and staff, starting with schools in areas most impacted by the pandemic.
Great, thank you. And then some questions about testing that are for particular cases, and just about some access questions. One, there was a question about whether students in middle school or high school could pick up the at-home kits and take home themselves, or if that must be something that a parent or guardian will pick up for them at the site. So I'm going to ask one more, hopefully you can hold that. And then for if there's a student that's identified an allergen that's allergic to something in the PCR test, are there swab tests or some of those tests that are out in the market that don't have that allergic reaction, and can parents contact a third party for those tests? So two different types of questions. First, can students in middle school or high school take their own kits home? And then what are the options if students have allergic reaction to the PCR test?
Yeah, I can speak to the first question, and then I might defer to Dr. Moss on the second question. But in terms of kind of consenting to testing and doing testing, individuals ages 13 and up can consent for themselves. So that's true for the rapid tests or the PCR tests that might be happening on campus with an actual tester, or it might be the at-home tests as well. And then Dr. Moss, I don't know if you want to speak to the second question.
With regard to allergies to the PCR test, the specimens are usually collected with the swab, but there are different types of tests out there. And I think if a student, if there's a kit that has an ingredient that the student can't come in contact with, certainly there are other tests that are available. I'm not familiar with all of the options that OUSD has, but I know there's more than one. So to my knowledge, there isn't something specific to the PCR test in general, but maybe one type of test kit has an ingredient, latex or something like that, that a student can't come in contact with. I would look and see if there's another kit out there that doesn't have that ingredient. There's a lot of options available.
Okay, great, thank you. So another question about implementation of our testing. When a family decides during modified quarantine to opt to continue to send their student to school and test twice weekly, and or a staff who's unvaccinated tests regularly, is that being tracked anywhere? Do the students need to, do the families who are getting tested twice a week report that on an honor system, or is there staff or testers documenting the students who are getting tested regularly?
Yes, so because the testing is all being provided by our testers that are being deployed and all the results are being logged in primary, we do have a record of everyone who tests on all of our sites.
Thank you. Okay. So now some questions about independent study when a student is quarantined. So if I could potentially pass to our Chief Academic Officer, can you speak to the at-home independent study option when a student does stay home for modified quarantine, what kind of independent study they can receive?
Yes. So good evening, everyone. Thank you for being here. Sandra Aguilera, I'm the Chief Academic Officer. So when a family is notified that there is a need to go into quarantine, there is an offer of independent study. As a district, we cannot make our families choose independent study, because quarantine is considered a excused absence. So there is an option to continue education. You will be provided work. The school does have 3 days to put together the agreement. Then they would share that with you, listing out the types of assignments that your student can do. And then from there, the student would be given credit based on the work that they complete. So that is our current system for independent study. And again, it is an option for families. Families do not need to go into independent study. They can opt to not do independent study. And we are encouraging our teachers to offer some Zoom sessions as well during that time. But right now it is currently optional for teachers to offer Zoom to students.
Great, thank you. And so the last group of questions, and then we may have time for just a few live questions before we close. We're getting close to the end of our time. Just there's some questions about increasing the support for the response teams. So actually, Dr. Aguilera, if you could also speak to how we're increasing the central office support to help with recording things, help with independent study, help with communication to families, all these issues that we're trying to problem solve. You can speak to our plans for increasing that support. And then if you or perhaps General Counsel could speak to if parents want to volunteer support, how would they go about doing that?
I can definitely answer the beginning of the question. We are creating more central office support teams. So currently, and we've been hearing from our school site principals and other staff that there's immediate needs that need attention on the campus. So there is a network superintendent for every school site. They are coordinating these teams to respond. So examples would be if overnight a series of teachers have tested positive, we are, responsible for covering the classroom, and we are short of subs. Subs aren't necessarily picking up the job, overnight or even after a couple of days. So we are deploying our central office staff that have credentials to fill those vacancies. Additionally, we are creating new teams due to the increase in cases. We are creating what's called the Central Office Support Team. So again, the network superintendent would send a team of our central office employees to a campus that needs additional help. And then on top of that, we are creating a cadre of our central office staff that can go to the school site when testing is happening, so COVID testing is happening. We have noticed that our families need more help accessing the primary application, both for registration is not taken care of, but for the consent. And so I've been to campuses to help parents register, and I know it's very time consuming, and the actual VESTRA people administering the test have struggled to both help the parents register and test. I've noticed in the Q&A there's been some comments about it taking a long time. So there will be central office staff that's deployed to go and help out at school sites. All of our central office people are being trained in these different ways to support school sites, and many of the supports will start on Monday and be expanded by Monday.
Great, thank you.
I think that the volunteer question should go to Chief or General Counsel Daniels.
We're also having problems hearing you, General Counsel Daniels.
Can you hear me now?
Yes, we can.
Okay, I'm sorry. I was focusing on responding to a question. Would you mind repeating the question? I apologize.
Sure. There's just a general question here about getting more support out to the school sites to respond to these cases in communication. And so Dr. Aguilera shared how we're deploying more central office staff to support in multiple different ways. And there's one attendee shared there's some parents or families or even organizations that would like to help support. Is that possible? And if so, what would they need to do to be able to support on campuses in that way?
I'll put my email. Just please email me. There are some restrictions on who can administer the swabs, and we don't want to overwhelm sites even more so it needs to be done in a coordinated way. But if there are organizations that are interested, please let me know. We're in touch with the Ed Fund to see whether volunteers are something that will help us administer more tests more quickly.
Okay, thank you. So we are coming to the close of our time of 7:15. We have a couple minutes. I do see that there's hands up. Probably we'll be able to just take one live question. So those of you who have your hands up, make sure your questions are in the chat. We are capturing all of these questions, even the ones we weren't able to address, either by typing the response or asking out loud to inform our future communications and our future planning. So let's just take one live question and then we'll go to closing comments. So Sonia Chen, go ahead and unmute yourself. Okay, let me try. Karen, go ahead and unmute yourself.
Hello.
Yes, we can hear you.
喂，你好。Hello。
Karen，輪到你講。
哦，我想問啊，頭先我聽到佢哋講啊防疫之類嘅嘢，我都好多謝咧 Ousd 咧有開放網課俾我哋啲家長選擇，等啲小朋友可以翻去網課咯。但係我另一個問題，我就想問 Ousd 嘅高層咯，因為而家小朋友翻咗去學校入邊，上課時間好短喎，今個禮拜已經係第3個禮拜啦。我哋低年級啲小朋友從 K 到5年級，每日淨係上半個鐘頭課啫喎。老師提供嘅作業咧係第2個禮拜有作業，之後都冇作業啦。而且咧，我哋連嗰啲咧之前喺學校可以使用嗰啲running app 咧，全部都唔可以用，全部都已經expire 啦。即係小朋友而家咧唔使翻學校喺屋企學嘅 distance running 咧，完全係處於好似係點講咧，係學唔到嘢嘅狀態咯。即係我比較焦慮嘅就係、小朋友咁嘅狀態，點樣跟翻去佢本身 Ousd 嘅學習步伐咧？另一方面就係我覺得
，OK， Karen， 你等一等，我翻譯咗呢一部分先。Karen， 你等一等。
老師唔係固定嘅喎，我小朋友係上2年級，我好似見到佢上呢2個禮拜有3個唔同嘅老師，每日都會嚟嘅，即係唔同咁嚟咯。
Yeah。Okay, Karen, first, thank you everybody. Answering the question about the testing and then offering, the distant learning. But she had a very concern about, the quality of the distant learning because her child is a 2nd grade. So within the last 2 weeks, she see like 3 different teachers teaching her. And on the first couple of weeks, she only had like 30 minutes classes time and then, homework. But this week, the kids only had like 30 minutes each day and then, no homework. She think that the quality of the distant learning is is not enough. So and also we had the app in the past can let the parent and student use, but they all expire. And then she worry about how can her 2nd grader can catch up with the 2nd grade level for the district level. So she don't know. She kind of like nervous and anxious about that.
Okay, great. Yeah, go ahead.
Okay, I can answer the question about the Sojourner Truth Independent Study. We've been discussing the quality of the program, and we know it's not yet at the level it should be. We quite frankly had prepared for 500 students, and every day the numbers have been increasing. We did have 25 vacancies For Sojourner Truth, we've really been short-staffed at the school site. So we have been having multiple teachers create many Zoom opportunities for families, but they have been short. So the good news is that we had a session today just to verify what we call onboarding, and we have most of the teachers starting on Monday. They will be in session. So the school site leadership will be emailing and sending out messages through Parent Square to families to introduce their new teachers, and they will be starting, that week. So agree that the quality of the program has not been to where it needs to be. The families will start to see a shift in meeting more of the schedule because we now have the staff adequate to open up the complete programming for Sojourner Truth.
Okay, thank you. So we are at time, but I'm going to take 2 questions. If you need to leave, attendees, thank you so much for joining. We are going to post this recording on our website. And as I said, save all the questions in the Q&A. So I'm going to ask one question to General Counsel Daniels, and then we're going to go to a student who has her hand raised, Aneve. But first question is about just General Counsel Daniel, can you speak to some of the issues that we've learned about from our testing around the PCR test, and speak to just how we found out the problem being related to actual human factors versus actual reliability of the test? And there's some questions about that. Thank you.
Sure. Can you hear me okay, Ms. Talkington? Okay. So there's been a few challenges we've had. One, which was earlier last week, there was a delay in batches of PCR tests that needed to be sent to a lab for analysis. We did quite a few of them last week. Most of them were processed timely, usually within about a couple of days, but a few of them were delayed longer, and then a few of them were miscoded as the wrong test. And when that happens, the lab is unable to process them because they get sent to the wrong place or somehow in the system wrong. And so those are effectively just lost. We have about 135 of those. Then, as some of you may have heard because of some news reports, there were the rapid tests, a number of students at primarily 3 schools were flagged as being positive in rapid tests, and subsequent PCR tests came back and showed that they were negative. At first, we described those initial rapid positives as false positives, but as we've come to understand the situation better, we really should be describing them as misreads rather than false positives. False positives would indicate that the test itself read positive, but was wrong. In this situation, the tests should have been read either as inconclusive or as negative. The rapid tests themselves, when read correctly, are highly accurate. They're very trustworthy. The breakdown in this situation was the individual testers that misread them and labeled them as positive rather than inconclusive or negative. That's important because you want to make sure, it is the test and the testing system that keeps our kids safe. And so we want to make it clear that, with better training, better coordination, better checks, we've been actually able to detect a couple of more of those in advance and not have the disruption that was caused at those 3 schools last week. So, we recognize that, we need to make sure we have those checks in place. We put those checks in place. While I'm sure, we'll still work on improvements, we feel confident that moving forward, we will, find, even if there is a misread, we will find it out before it gets too far down in the process and quarantines begin.
Can you just clarify, Director Downs, not every test that was taken on those dates, there was an issue, correct?
Oh, no. I think there was a communication that went out from primary that said all PCR tests on August 16th, 17th, and 18th were not processed, and that was a mistake on primary's part. I confirmed with them directly. It was only about 135. There were hundreds more that were processed properly.
Okay, thank you. So let's take this question from a student in the attendee, Anave. Go ahead and unmute yourself.
Hi, so I kind of wanted to get into I think like the big deal in the summer was the ultimatum given by the OUSD. You know, you have to give up your spot at your public school and choose Sojourner Truth, or you had to stay at school. And I know a lot of family, including mine, were really considering Sojourner, and I was really considering Sojourner. But the reason why I put at Oakland High was because OUSD sent out these emails reassuring families that you know, they were going to sanitize desks and sanitize Chromebooks and disinfect the doorknobs and just make sure that we're safe, have custodians, you know, cleaning and everything. And also because of how involved I am in Oakland High and the OUSD, that's another reason why I chose to keep my spot at Oakland High. But within the weeks that I've been there, like, teachers are not sanitizing computers. I've started bringing my own computer, and I've known other students that felt like they needed to start bringing their own computer because they're not sanitizing computers. I've seen like my classmates put their computers in, the other class come in, the other class period, take the computer out, use it. They're not sanitizing after each class period. I think I saw that in an email. They're not sanitizing desks and chairs. They're just kind of, you know, letting us sit. And then the other thing is I've seen the janitor cleaning doorknobs and stuff, but the janitors are using like the same rags on each doorknob and everything. And like, the other thing that I also wanted to bring up is you have students quarantined, which they're missing in-person class, but also I know students that were waiting in line to get tested since 8:15 in the morning and didn't get tested until 12 o'clock in the afternoon. So you have these big majority of students both missing in-person class, but you're still pushing us to stay in person. So, you know, if we're, right now I only have 10 students in like my classes, and you know, I understand that they have to quarantine and everything, but I feel like it's really pushing us behind. And for me as well, I quarantine, and the teachers are kind of throwing all this work onto Google Classroom but aren't explaining nothing. So it's like I feel like the students are really getting like impacted, and I don't think the teachers or like the district is really realizing how much they're getting impacted. So I just wanted to get your guys' take on that. You know, like, why were we given this ultimatum? And we had to make a big decision, but you guys aren't pulling through, the district isn't pulling through to make sure that everything is properly sanitized like they stated on the emails that were sent out before the school year.
Okay, thank you, Anave. You raised lots of things to follow up. And so what I want to suggest is if we can get in contact with you through Director Powell and Director Gallegos to follow up on your questions, even outside of this time, and potentially even hold a space for more students. I'm hearing you're wanting to hear about the cleaning protocols at the school because you're concerned about the doorknobs and other things being cleaned. You also support for teachers and explanation for the independent study that comes home. I heard you mentioning that. And then I heard your overall question of some of these issues with being in school. Why did you have to choose to be in school versus going to distant or independent study? And so I believe there is a choice for going to independent study. There is a wait list, and you can't be enrolled in more than one school at one time. So there is a choice there. So I think that's your overall question, but I want to be able to follow up more directly with you on all of the great feedback you're giving on how your experience at this time as a student. With that, let me pass to our host here, Vice President Davis and Student Directors Gallegos and Pell, to share any closing remarks.
Thank you so much, Ms. Talkington, and I appreciate everybody joining tonight. I do want to note that we answered over 100 questions via the Q&A. I really appreciate all of the staff who participated tonight. I want to thank Dr. Moss and Chaz Garcia for their participation. and absolutely also appreciate all the staff and also Director Gallegos and Director Powell for helping out. And I do want to recognize, I think it has been a really challenging beginning to the year in terms of just the number of new systems, new processes that we're trying to put in place. I know there's been challenges with the testing company that the state of California, contracted for us. And we are trying to learn from that process and change how it's working. But it had, there have been 20,000 tests over the past couple of weeks, which is a huge step forward. And I hope that we will continue to see staff expanding testing capacity and expanding testing opportunities for everybody. And that we'll continue to see students wearing their masks, students getting vaccinated, and teachers and staff getting vaccinated, and the ventilation improvements all bearing fruit and keeping our students safe. So with that, I'll just pass it over to Director Gallegos if she wants to say any last words. I think Director Powell may have jumped off. Not seeing her.
Yeah, she did have to go. But I did want to bring up just the importance of, this is why we need our students. Anime was a great representation of why we need our students to come to these spaces and to come to meetings, even if it's not this. If they're not comfortable with this, they can always come to our ACC meetings, because we always want to hear their input. We always want to hear their concerns, because after all, the students is what's making up OUSD, and we are the ones going to schools. So we do need more youth, because although me and Sam and the rest of ACC speak up for our students, they need to feel like they can be heard as well, so they can say their own words and their voices can be heard. So we need to just hear from young people so our school board can hear, so we can address them with all the concerns that we have. But I also did want to thank everyone who did come out tonight to our Q&A panel. And thank you, Sam Davis, for having me and Sam here tonight. And thank you to our guests who answered questions for us.
Thank you so much. Well, with that, I think we'll end the meeting for tonight. And I know there's still some questions left, but hopefully we can continue to address those in future sessions. So thank you so much, everybody. Thanks to our guests, and thanks to the staff and the student directors.